Hello everyone, welcome to the ITLS Academy. Today we are going to discuss the topic that is your overview of nutraceutical. So we all know that this nutraceutical are made up of two words. One is your nutrients and another one is your pharmaceutical. Okay, so what should we do? We use food as a medicine. In nutraceutical, what should we do? We use food as a medicine. Okay. So here we are going to see that different food and their medicational important. So the first one, see the content, we are going to discuss about the history, definition, introduction, classification, scope, area by nutraceutical covered by nutraceutical, marketed product, and conclusion. Now the first one is your history. If we see the history of the nutraceutical, then of Hippocrate are known as a father of medicine. Hippocrate known as a father of medicine. He is what? He is a Greek physician. Okay, he is what? He is a Greek physician. According to him, he said that let the food be the medicine, okay, and the medicine be the food. Okay, he said that either you kept the food as a medicine or medicine take a medicine as a food. So the philosophy behind is that if you want to take a food as a medicine, or either you have to take a medicine as a food. So see, focus on prevention. This nutraceutical word are first coined in 1989. Okay, and this nutraceutical word are the combination of two words. One is nutrition and other one is your pharmaceutical. Okay, it is coined in when? It is coined in 1989, and it is coined by a Dr. Stephen D. Fellis. Okay, he is what? He is a MD, founder and chairman of the Foundation for Innovation in Medicine. Okay, according to him, nutraceutical was combined with the help of two words. One is your nutrition and another one is your pharmaceutical. And he coined this nutraceutical word in 1989. Who? Dr. Stephen D. Fellis. According to him, nutraceutical are what? Nutraceutical is any substance or a part of the substance which provide both medicational benefit, or even it provide the food. Okay, so in medicational benefit or in a health benefit, it is included both the prevention of the disease or even the treatment of the disease. So according to Dr. D. Fellis, nutraceutical is any type of food that provide nutrition to the human being, and along with the nutrition, it also have a health benefit. And this health benefit is this health benefit including either the prevention of the disease and the treatment of the disease. Now see what is written in the slide. Nutraceutical is any substance that is a food or a part of the food that provide medicational or health benefit, including the prevention and treatment of the disease. Okay, now the second one is that according to the health minister of Canada, okay, he said that as a product isolated or purified from a food generally sold in a medicinal form, not associated with food, and demonstrated to have a physiological benefit and provide protection against a chronic disease. Even this nutraceutical are what? They are a product which are isolated from a purified product, food product, and they are sold in a market as a medicine, and it also protect the person from a chronic disease. Now come to the next slide. Now see the definition of the nutraceutical. Simply, nutraceutical are what? Nutraceutical is a food or a part of the food who have uh, nutritional benefit, and along with nutrition benefit they also have a health benefit. Okay, they are a what? They are a non-toxic food substance which have, and they are scientifically proven Uh, they are scientifically proven health benefit like your treatment of the disease or prevention of the disease. Now see what is written in the what is written in the slide. A nutraceutical is any substance considered as a food. Okay, when we consider food as a nutraceutical, when one part of it have a normal function, that is provide the nutrition to the human being, and along with nutrition they also have a health benefit, including your prevention of the disease or promotion of the health. It is non-toxic food component that has scientifically proven health benefit, including disease treatment or prevention. The functional component of the food must be standardized in the nutraceutical product and produce undergo a good manufacturing practices. So simply the nutraceutical are considered as a nutraceutical when a nutraceutical are what they are a food. Okay, and it consider the food is considered as a nutraceutical when they have both benefit, like they also have a nutritional value, and along with the nutrition value they also provide the health benefit, including the prevention of the disease and even the promotion of the health. Now the come to the next slide. Food as a medicine. Okay, it is very common. What we have to do, we have to take as a food as a medicine, not a medicine as a food. We have only two choice. Either we have take a food as a medicine or medicine as a food. So I think the first option is better. We have to take a food as a medicine. Now nearly two-thirds of the world's 6.1 billion people rely on the healing power and plant-based material for many reasons like availability, affordability, safety, and their believe in traditional affordability or believe in traditional cure. Okay, so if we see that around 6.1 billion people in the world, they they believe that if we want to cure some disease, so we have to go to a plant based material. Okay, and there is a many reason behind it, like the availability of the material or affordability of the material, or even they have believed that this traditional affordability are much better for the curing of the disease. Medical benefits of food have been explored for thousands of years. Modern nutraceutical industry began to develop in a 1980. Okay, in this slide, the pharmaceutical means that in pharmaceutical drugs are used for the treatment of the disease, and in nutraceutical nutrients are used to prevent the disease. Okay, nutraceutical also provide the nutrition, and along with the nutrition, it prevent the human being from the disease. Prevent the human being from the disease. Okay, so that's why the nutraceutical have less harmful effect in the human body as compared to this pharmaceutical product, because this pharmaceutical are totally what they are totally are chemical based. Now come to the next slide. Nutrition required for health plus pharmaceutical remedy for sickness injury is equal to nutraceutical preventive medicational approach. This is called what? This is a concept of nutraceutical. Okay, nutrition required for health, and along with that, the pharmaceutical remedy for the sickness. They combine together and known as a nutraceutical preventive medical approach. Now come to the next slide. Nutraceutical can be classified classified as a potential nutraceutical and established nutraceutical. Okay, this nutraceutical are classified into a two group. One is your potential nutraceutical, and the second one is your established nutraceutical. Okay, the potential nutraceutical are defined as a promising approach towards a particular health or a medicinal benefits. And established nutraceutical is a potential nutraceutical. This potential nutraceutical become established nutraceutical only after there are sufficient clinical use to demonstrate a benefit. Okay, when this potential nutraceutical have numbers of trial or clinical use, then it is demonstrated as a established nutraceutical, and they have what they have a health benefit. Okay, now this nutraceutical may either contain nutrients, either contain herbs and phytochemicals, or either they contain a dietary supplement. Okay, the nutrients means that they have a nutritive value, or it perform a nutritional function like your vitamins, minerals, amino acid, fatty acid. Okay, the herbal or phytochemicals are those type of product who have herbs or a botanical product, and the dietary supplement like your probiotic, prebiotic, antioxidant, and enzyme. Okay, now come to the next one. Scope of nutraceutical. Okay, see, this is a total chart in which we are going to discuss about different disease, and for that disease which type of nutraceutical we are going to use, and from which source we are get that type of nutraceutical. So the first type of disease is your joint health. Okay, joint health. For proper joint health, we need a nutraceutical glucose amine. Okay, and this glucose amine can be get from our ligament, cartilages, tissue, tendons. Okay, and the second nutraceutical for a joint health are chondroitin, and this get from a proteoglycan of articular cartilage. Okay, the second one is your cardiovascular health. Okay, so the first nutraceutical related to this cardiovascular health is CoQ10, that is called a CoQ10, and it is get from a soybean or olive oil. The second one is your melatonin. It is get from a bone marrow and pineal gland. Then after that melatonin, there is a DHA, which and the source of DHA is fish oil. Then resveratrol, and the source of resveratrol are grapes and red wine. Then carotenoids, which this carotenoid are get from a carrot, sweet potato. Catechin are get from a tea extract. Now come to the next one. The next is your eye health. The nutraceutical for eye health is DHA, and this DHA are get from a linseeds, that is your flax oil and fish oil. Uh, Pycnogyl, and it is get the source of pycnogyl is barley. Lutein, and the source of lutein is Spanish. Carotenoids, and the scope of carotenoid is carrot, sweet potatoes, and the second disease your cancer prevention, and the nutraceutical for cancer prevention is DHA, which is again get from where flaxseed, linseed, fish oil. Resveratrol, which is get from red wine grapes. Okay, lycopene, tomato, grape, fruit, tea extract, it is get from a strawberry and raspberry. Now, classification of nutraceutical. Nutraceutical are classified on three bases. One is your natural source, and another one is your pharmacological condition, and the last one is your chemical constitute. So, first classification are on the base of chemical group. The first class is your inorganic minerals. For example, minerals. The first one is your inorganic mineral supplement, and the example for this are minerals. Probiotic, helpful bacteria. Prebiotic, digestive enzyme. Dietary fibers. Antioxidant, and the example of antioxidant are natural antioxidant. Then the other class is your phytochemical, which are subdivided into different categories, like A, B, C, D, and E. The first one is your fatty acid, and the example of fatty acid is omega-3 fatty acid. Then phenolic, and the example of phenolic are T polyphenol. Isoprenoids, and the example of isoprenoids are carotenoids. Lipids, sphingolipids. Protein, soy protein. And the seventh one is your herb used as a functional food. Now come to the next slide. Next is classification on the basis of source. So either we get nutraceutical from plant, either we get from animals, either we get from minerals, or either we get nutraceutical from the microorganism. Okay, so the source of plant are tomato, garlic, and momordica, and animal source are shark liver oil, cod liver oil. And the source of minerals are calcium, magnesium, and phosphorus. Microorganism include bifidobacterium and lactobacilli. Now come to the next slide. Now we are going to discuss about the inorganic mineral supplement. The inorganic mineral supplement included calcium, magnesium, manganese, boron, copper, zinc, and phosphorus. Okay, so calcium, now we are going to see the benefit of this inorganic compound. Benefits of inorganic supplement. Inorganic supplement. The first one is your calcium. This calcium are essential for the bone and teeth health. Okay, and along with this, it also maintain the bone strength, nerve, muscles, and glandular function and blood clotting. Iron is essential for the production of the energy, hemoglobin, and oxygen transport. Okay, and this magnesium are benefit for a nerve, muscle function, bone formation. This phosphorus are also used in the production of energy, phosphorylation process, and it is also benefit in the health and bone for the health of bone and teeth and for a genetic material. Okay, then cobalt, component of vitamin B12 and B12 coenzyme. Copper is used in the formation of hemoglobin and collagen production, and along with this, they also they have also function of heart and they produce energy and also help in the absorption of the iron. Iodine is used for the proper functioning of the thyroid gland. Chromium is used to prevent the it is used to help in the conversion of carbohydrate and fat into a energy, and this is used in the treatment of diabetes. Selenium is used as an antioxidant and also useful in a useful it is also benefit for a heart muscles, part of the GPX enzyme. Zinc is essential for a cell production, and it is also used it is also used in the development of the nutrients, wound healing, and production of sperm and testosterone hormone. Okay, now come to the next one. After inorganic supplement, we are going to discuss about the vitamins. So first vitamin are fat soluble vitamin, which are A, D, E, K. So vitamin A is used as an antioxidant, and it is used it is essential for the growth and development, and it also maintain the vision, skin, and mucous membrane. Okay, it also used in the prevention and the treatment of the certain type of the cancer, and also used in the treatment of certain type of skin disorder. This vitamin D are essential for the formation of the bone and teeth, and it help the body to absorb and use calcium. Vitamin E is used as an antioxidant, and it is used for the formation of blood cells, and it boosts the immune system. And this vitamin K is essential for a blood clotting. Now the next one is your water soluble vitamin. After a fat soluble vitamin, the second one is your water soluble vitamin, which included vitamin C. Vitamin C are what they are antioxidant, which are necessary for a health bone, gum, teeth, and skin, help in wound healing, prevent from a common cold. The next one is your vitamin B1, which is help in the carbohydrate metabolism, and it is essential for a neurological function. And then vitamin B12, which are used in a energy metabolism, and it also maintain a healthy eye, skin, nerve, and function. Then vitamin B3, energy metabolism, it is used in the energy metabolism and proper brain function. Then vitamin B6, which are help in the production of essential protein, which convert the protein into a energy. Then vitamin B12, which are help in the production of genetic material and the formation of RBC, and it also maintains the CNS synthesis of amino acid involved in metabolism of protein, fat and carbohydrate. Now the next one is your folic acid, which are help in the formation of RBCs and the formation of the genetic material, and it is all essential during the pregnancy. For pantothenic acid, which are help in the synthesis of the cholesterol, steroid and fatty acid. Now the next one is your probiotic. Probiotic are what? They are a living organisms. Sorry, living microorganism. They are what? They are a living microorganisms, and it is when a person take it this probiotic, then they have a health benefit to the host cell. Species of Lactobacillus, Bifidobacterium, yeast, Saccharomyces cerevisiae, and some E. coli and Bacillus are the example of the prebiotic. Sorry, are the example of the probiotic. Example of the probiotics. Now the next one is your potential benefits of probiotic. It treats the diarrhea. It also shorten the duration of intestinal infection. It improves the symptom of irritable bowel, reduce the bladder and urinary tract infection, and manage the lactose intolerance. Now, prebiotic. Apart from the prebiotic are what? They are a non-digestible substance. Non-digestible substance. Okay, and they have a beneficial physiological effect to the host cell by stimulating the favorable growth of a limited number of indigenous bacteria. Common prebiotics are oligofractors, inulin, galacto, oligosaccharide, and lactulose. Now the next nutraceutical are herbs, and in herbs the first one is your aloe vera. Aloe vera have anti-inflammatory property, emollient and wound healing. Evening primrose oil, they have a benefit of diet. They used as a dietary supplement of linoleic acid treatment of atopic eczema. Then garlic is used as an antibacterial, antifungal and antithrombotic and anti-inflammatory effect. Ginger is used as a creminative, antiemetic and treatment of the disease, and ginseng is used as a adaptogen. Now the next one is your green tea, which is used as an antioxidant, and it also reduce the risk of cardiovascular disease and enhance the humoral and cell mediated immune. Different fruits, vegetable, whole grains, herb, nuts and various seeds have also have a phenolic compound, terpenoids, which terpenoids, and they also have a sulfur compound pigment that has been associated with the protection and treatment of certain type of disease. Okay, now the next one is your phytochemicals. Phytochemicals also have different health benefit. First one is your substrate. They have a biochemical reaction, then cofactor of enzymatic reaction, inhibitor of enzymatic reaction, absorbent that bind and eliminate the undesirable constitute in the intestine, and scavenger which are react to the toxic chemical. It also enhance the absorption of the certain nutrients, and they also have a benefit of selective growth factor for a beneficial bacteria, and it also used as a fermentation substrate for a beneficial bacteria and selective inhibitors of deteriorate intestinal bacteria. Now, some phytochemicals and their sources and role. First one is your tocotrienols and tocopherols. This tocotrienols and tocophenols are get from a grain, and the role of this tocophenol and tocotrienol are it suppress the growth of diverse tumor line via initiation of apoptosis and concomitant arrest of cell in G1 phase of the cell cycle. The second phytochemicals are carotenoid, and the source of carotenoids are fruits and vegetables. and role are antioxidant. They have a property of antioxidant. It protect against a uterine, prostate, colorectal, lungs and digestive tract cancer, and protection to other antioxidant. Okay, now the next one is your lemanoids, and the source are citrus fruit. It inhibit phase 1 enzyme and induce phase 2 detoxification enzyme in liver. It also provide protection to a lung tissue. Then phytosterol. The source are various plant, and the role are exhibit anti-inflammatory and neoplastic, antipyretic, and immune modulating activity. It also decrease the cholesterol level in the blood. Now the next one is your phenolic constitute, and the source are various plant and whole grain, and the role are antioxidant, lower the risk of CHD, diabetes, hypertension, etc. Now flavonoid, and the source of flavonoids are grapevine, and the role are action against free radicals. Free radicals mediated cellular signaling, inflammation, and allergies, platelet aggregation, and hepatotoxin. Then catechin and gallic acid sources are grape, berries, cocoa, green tea, acacia species, and the role are it act as an antioxidant, and it also act as a free radical scavenging scavenger. And the second one and the last one is your isoflavonoid, and the source of isoflavonoid are soya bean, and it is used in the treatment of cancer and osteoporosis. Okay, then after that, anthocyanin are get from fruits and flower, and the role are they have an antioxidant and antimonogenic property. Then glucosinolate get from a cruciferous. They are the activator of the liver, detoxification of the enzyme, inhibit the neoplastic effect of various carcinogen. Then indoles, which reduces the estrogen, and it totally depend upon and also reduces the risk of the cancer. Fiber, the source of fiber are various fruits and vegetable, and we get this fiber from sorry and the role of this fiber are it protect us against the colorectal disease. Now different fruits and their body benefit. If we take a 3 gram of apple, then the fiber present in into it meet your help you to meet your fiber goal of 20 gram and 30 gram daily. That means that if we eat 3 gram of apple daily, then it will cover up the fiber goal of daily. High fiber diet increases the decreases the high disease risk. Then apricot are a good source of beta carotene. Bananas, they are a great source of potassium and also play a great role in heart and muscles function. Then cherries protect the heart problems. Papayas are loaded with vitamin C and beta carotene and calcium. Then different vegetables and their body benefit. Broccoli is fulfill the demand of folic acid and vitamin C. Cabbage is cabbage is used as a cancer fighter. Carrots are used for carrot are used as a source of beta carotene, and these tomatoes are also uh, have a great source of vitamin C, and it also reduces the cancer risk. Then the what dietary fibers are the structurally they are what they are the carbohydrates of the plant. They are non-digestible or not absorbed by the human body. There are insoluble fibers, and they absorb water in gastrointestinal tract. It also promote the regular elimination, increase the stool weight, and speed up the digestion and eliminating time. Then the second one is your soluble. They have a health benefit. They lower the serum cholesterol and it also regulate the blood sugar level. Then intake of daily fiber decreases the many risk of the disease like your gastrointestinal disease, hypertension, diabetes, heart disease, and several types of cancer like your colon. The recommended daily allowances of the fibers are 20 to 35 gram per day. Best source of the fiber are fruit, vegetable, whole grain, bread, cereal, beans, rice, nuts, and seed. If you take a advocate amount of water, then it is also very important. Area covered by the nutraceutical like your anti-arthritic, sleeping disorder, digestion problem, prevention of certain cancers, osteoporosis, blood pressure, cholesterol lowering, neurological disorder, and diabetes. So these are the diseases which are come under the coverage of this nutraceutical. Now the next one is your nutraceutical in a market. Okay, so the functional food we are going to discuss in the next class. Here we are going to see only that the global nutraceutical market are divided into three categories like your functional food, functional beverages, and dietary supplement. Okay. Now, some pharma companies and their challenges, and some food companies and their challenges. Okay, so the pharma companies are what they decline the return on R&D investment, patent cliff, pressure on health budget, and regulatory oversight. Okay, and the food companies slow growing, retailer own brand and retailer power and internet marketing. These are the different uh, nutraceutical which are available in the market, and their component and their function like betaine. There is a brand name betaine who are a nutraceutical and they contain carotenoid, and the function are it is used for a proper immune function. Zen Gold, it contains lutein ster. It is good for eye health. Then Lipo, which contain alpha lipoic acid, and it is benefit in a potent antioxidant. Then Generol, it contain a phytosterol. It is help in a CHD reduction. Premium probiotic, it contain probiotic which are help in a intestinal disorder. Soy Life, which contains soybean and phytoestrogen, and they have good bone health. They provide the good bone health. Again, there are also some brand like your Z Trim which contain wheat and they have function of zero caloric fat and etc. Now the next one is your conclusion. Conclusion is that nutraceutical are present in most of the food ingredient with varying concentration. Concentration, time, duration of supply of nutraceutical influence human health. Manipulating the food, the concentration of active ingredient can be increased. Diet rich in nutraceutical along with regular exercise, stress reduction, maintenance of health body weight will be maximize the health and reduce the disease risk. This is all about the nutraceutical. Thank you for watching. If you have any query, just let us know in a comment box. Please like, share, subscribe. If you can also ask your query to the helpline number which are already mentioned in your account. You can also follow the ITLS Academy on different platform: Instagram, Facebook, Twitter, YouTube, WhatsApp, LinkedIn, and subscribe ITLS Academy on YouTube and get our app from a Google Play. Thank you. If you have any query, just let us know in a comment box.